A pleasant day to all of us, and I hope everybody is safe. I am Jehanna SALALODING, tasked to report most common problems and their solution that adolescents have to deal with the health problem. Health problems lead to a serious illness, and the worst thing is death. So we need to address some common issues, problems faced by adolescents nowadays, give an advice or solution to avoid as much as possible to this kind of problem. First, injuries includes road trafficking incidents in pedestrian. Cyclists or more adolescents are involved. So given the solutions, road safety law need to be more comprehensive and to be strengthened. Furthermore, young driver needs advice on driving safety, while law that prohibited driving under the influence of drug and alcohol need to be strictly enforced among all age group. Remember that the blood alcohol level should be set lower for young driver than for adult. So second, violence. Interpersonal violence is also leading cause of death, including different kinds of bullying, and I know you're familiar with difference of it: physical, verbal, social, and cyberbullying. So sexual violence affect also the mental problem of adolescents that lead sexual transmitted infection, HIV, mental health problem, poor school performance, early pregnancy, reproductive health, and many to mention. So solution: effective prevention and response strategy in this issue, including promoting parental and early childhood development, addressing school-based bullying prevention, program that develop life and social skills, and community approach to reduce access to alcohol and firearms. Effective empathetic care for adolescent survivor of violence, including ongoing support, can help with the physical and psychological consequences. Third, mental health includes depression. This is included to a leading cause of illness and disability among adolescents, and suicide. Although mental health disorder in adolescents starts by age of 14, many factors have an impact on the well-being and mental health of adolescents. Violence, poverty, stigma, exclusions, and living in humanitarian and fragile setting can increase the risk of developing mental health problems. The consequence of not addressing adolescents' mental health condition extend to adult, impairing both physical and mental health and limiting opportunities to lead fulfilling lives in adolescence. Building social emotional skills in the children and adolescents and providing them with psychological support in the school and the other community setting can help promote good mental health care, aware them to some possibilities or outcomes so that themselves will help to gain and be healed. In that way, there are union of support between the healthcare and the victims. Fourth, early pregnancy and childbirth. This is considered as a center of some main problem and issue nowadays, such as include the result of increase of population, poverty, and especially affect their living. So solution: the world should ensure universal access to sexual and reproductive healthcare service, including for family planning, information and education, and integration of reproductive health into national strategy and programs. The right to comprehensive sexual education, a curriculum-based process of teaching and learning about cognitive, emotional, physical, and social aspect of sexuality, and girls who do become pregnant need access to quality antenatal care were permitted by law. Adolescents who option to permit their pregnancy should have access to safe abortion. Fifth, nutrition and micronutrient deficiency. Commonly encountered by our fellow women will result in disease somehow. So the solution: iron and folic acid supplement are solutions that also help to promote health before adolescents become parents. And regular deworming in area where intestinal helminth such as hookworm are commonly is recommended to prevent micronutrient deficiency. Here are the common causes of the said problem and issues. They are in a developmental transition stage, where adolescents and young adults are particularly sensitive to influence by their social environment, includes family, friend, school, and neighborhood can either be support and threaten young people's health and well-being. Drinking alcohol among adolescents is a major concern in many countries. It can reduce self-control and increase risk of behavior that result to a discussed issue a while ago. Setting a minimum age for buying, increasing the price through higher taxes, consuming alcohol, and eliminate market and advertisement to minor and among the key strategy to reducing drinking among adolescents. Adolescents are vulnerable emotionally and physically. Without proper nutrition and health care, they are susceptible to illness. According to 2015 WHO report, 1.3 million adolescents died in 2015, and a majority of them have preventable diseases. Teenagers have a hectic schedule as they hop from one activity to another with a little time to eat or rest properly. Unhealthy eating habits prevent them from getting the nutrition they need. Unhealthy eating habit and less active lifestyle would also lead to obesity. This is often the case when young children consume a lot of empty calories through fast food and sodas. Consciousness about their body can lead to eating disorder, especially in girls. Adolescent girls who carry out their weight and appearance can develop disorder like bulimia. Stress can also lead to loss of appetite and sleeplessness in young children. So here are the summary of solutions that I've mentioned a while ago. First, parental guidance is considered number one solution because everything is happened first in our prospective home. So need to discipline our own children can help avoid health problem in adolescents to maintain a healthy lifestyle. Leading by example and encourage your children to eat healthy food, exercise right, and sleep on time. Ensure they get the nutrition through their meal. Give them a balanced diet. Be there for them emotionally and physically as this will help them deal with any possible disorder. Access to health care includes the school-based health care service, state graduate driver license, program that educate adolescents in terms of prevention of alcohol, violence prevention and mental health, teen pregnancy and HIV prevention. We, a future teacher, should also become a number one disciplinary and help students physically, emotionally, mentally, and psychologically, given that a teacher is considered as a second parent and the room is considered as a second home.